Hello there, my name is Artur Valerievich and I teach anatomy. And today we're gonna speak about plexus brachialis, about brachial plexus and its branches. And first of all, we speak about how it formed. So brachial plexus, plexus brachialis, it's formed, as you can see, by anterior branches of lower 4 cervical nerves and the greater part of first thoracic. So here you have anterior branches of these nerves that join and create plexus brachialis, brachial plexus. And brachial plexus actually divided on 2 parts. So we have part above clavicle, so it calls pars supraclavicularis, and below it, so pars infraclavicularis. And pars supraclavicularis, it consists of 3 trunks. As you can see, 3 trunks: truncus superior, truncus medius, and truncus inferior. Pars infraclavicularis consists of 3 bundles: fasciculus, fasciculus medialis, fasciculus lateralis, and fasciculus posterior. Pars supraclavicularis is formed by these trunks and situated with arteria subclavia in this space, in spatium interscalene. Then all its trunks go down and enters axillary cavity. It goes to cavitas axillaris and surrounds arteria axillaris. And one bundle is situated to the middle, another laterally, and third behind. So that's why we have fasciculus medialis, fasciculus lateralis, and behind will be this fasciculus posterior. So this is what brachial plexus consists of. This is what its topography. I'm gonna speak about short branches. We have 3 nerves that go to scapula. So first one, nervus dorsalis scapula. It go along with musculus levator scapula. Here it is. Go down to the middle marge of scapula and innervates muscles that insert there. Dorsalis scapula innervates musculus levator scapula, musculus rhomboidus minor, and rhomboidus major. Next one, it's nervus suprascapularis. There it is. It's a company arteria with the same name, arteria suprascapularis. They go to the into incisura, as you can see, enters supraspinatus fossa, then go around spine and enters infraspinous fossa and innervates muscles that occupy these places: musculus supraspinatus and musculus infraspinatus. And the last one, it's nervus subscapularis, nervus subscapularis superior and like nervus subscapularis inferior, upper and lower. So nervus subscapularis, first of all, it's innervates muscle with the same name. It innervates musculus subscapularis, and like if there will be lower part of this nerve, it also innervates, as you can see, musculus teres major. So here you have 3 nerves that go to scapula. Next, one small nerve, but Netter didn't draw it. I don't know why. Small nervus subclavius. You remember here this small muscle, musculus subclavius. So it must have innervation. So we have small nerve, nervus subclavius, that innervates only this muscle. Next, we have 2 pectoral nerves, nervus pectoralis medialis and nervus pectoralis lateralis, that supply your pectoralis major and pectoralis minor muscles. Next, we have 2 nerves that lay on your thorax. First of them, it's nervus thoracicus longus, like long thoracic nerve. It's actually laying on lateral wall, go down, accompany arteria thoracolateralis, and innervates musculus serratus anterior. And thoraco-dorsalis. Thoraco-dorsal nerve also accompany the same arteria thoracico-dorsalis. Here it is. And supply musculus latissimus dorsi. Now we go to bundles, and we start with posterior bundles. So as you can see here, this is fasciculus posterior here, and it divides onto nerves, on nervus radialis, this one, and nervus axillaris. Actually, axillary nerve, nervus axillaris, it also related to short branches, although it originated from bundle, but it's short. So nervus axillaris. Axillary nerve, as you can see here, go backward, go through foramen quadrilaterum with arteria circumflexa humeri posterior, and divide on motor branches that supply this musculus teres minor and actually musculus deltoidus. It's motor branches and have a few sensory branches that will supply your shoulder joint, articulatio humeri, and it have one cutaneous branch that innervates your skin in like this area of deltoid muscle, and this branch called nervus cutaneus brachii superior lateralis, superlateral cutaneous branch of axillary nerve. And now we continue with nervus radialis. It's radial nerve that it's like direct continuation of posterior bundle of fasciculus posterior. It go also backward and enters its canal. It's also accompanied arteria profunda brachii, if you remember, and then enters between heads of triceps brachii, and then leaves this canal between brachialis and brachioradialis muscles. And in this canal, before it enters canal, after it exit canal, and in this canal, it gives a lot of branches. So if you talk about sensory branches, before nervus radialis enters its canal, it gives first sensory branch that go under the skin on posterior surface of your brachial and supply skin of posterior surface of arm, and it calls nervus cutaneus brachii posterior. Then it gives second sensory branch, and it's laying on posterior surface under the skin of your posterior surface of forearm, and it innervates it, and it calls nervus cutaneus antebrachii posterior, posterior cutaneous nerve of forearm. While it go in canal, it gives a lot of motor branches to the nearby muscles, to musculus. Triceps brachii, so nervus radialis innervates triceps brachii and also this small musculus anconus. Nervus radialis leaves this canal between brachialis and brachioradialis muscle and divides. And there it divides on two branches, on long and small superficial branch, ramus superficialis nervoradialis, and like short but big deep branch, ramus profundus nervoradialis. So superficial. If we talk about superficial branch, as you can see, it's laying on anterior surface of forearm, it's laying under brachioradialis muscle, then it go under the skin in the lower part of your arm, it go out, and on the level of styloid process of radius, it divides on few branches that go through anatomical snuff box and divides on 5 branches, dorsal digital branches. 2 of them go to your pollex, to thumb, 2 of them go to your second finger, and 1 go to third finger. It innervates skin of this area of dorsal surface of your hand, half, as you can see, and like proximal phalanx of your first finger, proximal phalanx of your second finger, and half, like lateral half of proximal phalanx of your third finger. If you talk about deep branch, it's most of its nerves are motor. It's penetrates, as you can see, musculus supinator, and divides on a lot of motor branches, and they are innervates all posterior group of muscles of forearm. Also, it supply not only posterior group, it supply also brachioradialis muscle. It's related to anterior group. and elbow joint, of course, articulația cubice. So that's all about radial nerve. We have two more bundles or fascicles. It's fasciculus lateralis and fasciculus medialis. To the middle or to the side of arteria axillaris, of the axillary artery. So again, I will repeat, fasciculus lateralis divide on two nerves or two branches. It's nervus musculocutaneus and lateral root of nervus medianus. Fasciculus medialis, so give medial root of nervus medianus, then give nervus ulnaris, and two cutaneous nerves, two cutaneous branches. It's nervus antebrachii and nervus cutaneus brachii. So we will proceed with nervus musculocutaneus. It goes, as you can see, it declines laterally and it goes through coraca brachialis muscle. It goes through coraca brachial muscle. Then it's laying on musculus brachialis between biceps and brachialis. Gives a lot of motor branches to them and innervates. So this nervus musculocutaneus actually innervates these three muscles: coraca brachialis, biceps brachii, and brachialis. It's anterior group of muscles of your brachium. So it's motor branches, but it also have one sensory branch, so one cutaneous branch. It's actually like continuation of this nerve. It goes under the skin from the lateral marge of biceps and go down on this area and innervates a skin of anterior lateral surface of your forearm. And this branch calls nervus cutaneus antebrachii lateralis, lateral cutaneous nerve of forearm. Next we go to nervus medianus. Again, nervus medianus, as you can see, formed by two roots. One root it came from lateral bundle, medial root came from medial bundle. They unite and create actually nervus medianus. Nervus medianus go down and it accompany arteria brachialis. It go within like neurovascular bundle of your brachium, with arteria brachialis, with brachial veins, and even with nervus ulnaris. We will talk about it later. So it go down, then it go into the cubital fossa, go on forearm, and there it penetrate musculus pronator teres, and then situated on the forearm between your superficial and deep flexors of fingers, between musculus flexor digitorum superficialis and musculus flexor digitorum profundus. Then it's go through canalis carpalis, as you can see, under retinaculum flexorum, and get on your hand, and then it will divide on terminal branches. On the brachium, nervus medianus doesn't innervate anything. So nervus medianus, you must understand, nervus medianus actually innervates almost all anterior group of muscles of forearm. Then it gives a small carpal palmar branch on the level of wrist and innervates skin, and then it go on your hand. On the hand, it gives a lot of branches, as you can see, and you can divide them on deep and superficial. All deep branches, they are motor branches and innervates muscles. Superficial branches are sensory and innervate skin. So if we talk about deep motor branches, supply muscles of your tenor, muscles of your thumb, almost all, except for adductor pollicis and the deep head of shirt flexor of pollex. And as you can see, it narrates first and second musculi lumbricalis. Sensory skin branches, they divide on palmar digital proper branches and innervates, as you can see, palmar surface of all thumb, palmar surface of all second finger, palmar surface of all third finger, and lateral aspect of fourth finger, and skin, half of your skin of your hand, palmar surface. But it innervates not only palmar surface. As you can see, it gives also dorsal branches of fingers, and they are reach posterior surface of distal phalanx of thumb, posterior surface of distal phalanx of second finger, so posterior surface of distal phalanx of third finger, and also lateral aspect of distal phalanx of fourth finger. Then we can proceed with medial bundle. So we come back to bundles and medial bundle. Fasciculus medialis, again, it gives a medial root of nervus medianus. It gives two cutaneous nerves and nervus ulnaris. So this is nervus ulnaris. Ulnar nerve is, you can see here, it's also on the brachium. It's situated in this neurovascular bundle with arteria, brachialis, veins, and nervus medianus, but in the lower part of your brachium, it decline posteriorly and go behind the epicondylus medialis. But then it came back on anterior side of forearm and situated, as you can see, in this groove. You remember sulcus antebrachial ulnaris between flexor carpi ulnaris and flexor digitorum superficialis and profundus with its accompanying arteria with the same name, and it go down until the wrist and it come to your hand. So on the forearm it gives these motor branches to these two muscles. So nervus ulnaris on forearm innervates this flexor carpi ulnaris and flexor digitorum profundus, only half of it, only ulnar head, the caput ulnaris, or this deep flexor of fingers. Then on the level of above styloid process of ulna, it gives dorsal branch. Here is the ramus dorsalis that go to the back side. It's going on dorsal side of your hand. It's only sensory branch, and this dorsal branch innervates, as you can see, all dorsal surface of last finger, fifth. It innervates like a medial aspect of all the fourth finger and lateral aspect of only proximal phalanx of fourth finger, and innervates medial aspect of proximal phalanx of third finger, and the dorsal and half of dorsal surface of your hand. It's ramus dorsalis. This will be ramus palmaris that is going on your hand. It also gives this carpal palmar branch that innervates skin of your wrist, of medial portion of skin of wrist, and then it enters hand. And on the hand, it also, this palmar branch divides on superficial and deep parts or branches. So superficial, it also sensory, and this superficial divides on digital palmar proper nerves that supply all palmar surface of your fifth finger and the medial aspect of all fourth finger, and this half of skin of your palmar surface of hand. A deep branch, ramus profundus of palmar part of ulnaris, it's actually a motor branch, and it go and supply all the rest muscles of your hand. First of all, it supply your all muscles of hypotenor, then it supply your medial group of muscles of hand, then it supply third and fourth lumbricalis muscles, and also it reach one and even two muscles of tenor, and it supply musculus adductor pollicis, this one, and this you can see deep head of short flexor of pollex. And the last two nerves of medial bundle, it's two cutaneous nerves. It's nervus cutaneus antebrachii medialis and nervus cutaneus brachii medialis. Cutaneous brachii medialis, here it is, these branches. It's going on like not only medial, it's supply in the anterior and medial surface of your brachium. Cutaneous antebrachii medialis go further on antebrachium, on forearm, and divides on branches that supply actually like anterior medial surface of skin of your forearm. So now you know all the nerves of brachial plexus, and we can describe review of innervation of your upper limb. So let's start with skin. So if you talk about innervation of skin, upper limb, we will start with a region of brachium. Superior part of brachium is deltoid region. It's innervated by branch of axillaris. It's nervus cutaneus brachii lateralis. Then brachium. Posterior surface of brachium, like on this level, it's supplied by nervus cutaneus brachii posterior. It's the branch of nervus radialis, you remember. Anterior surface, it's supplied by nervus cutaneus brachii medialis. It's the branch of medial bundle. Then forearm. Back side of forearm posterior surface, it's supplied by nervus cutaneus antebrachii posterior. It's a branch of also radial nerve. Anterior surface of forearm have two region, lateral part. It's supplied by nervus cutaneus antebrachii lateralis. It's terminal branch of musculocutaneous nerve. Medial aspect, it's supplied by nervus cutaneus antebrachii medialis. It's a direct branch of medial bundle of brachial plexus. And hand. If you talk about palmar surface of hand, it's supplied by skin. If you talk about skin, it's supplied by two nerves. Nervus medianus, it supply like half, greater half of your hand, and all palmar surface of first, second, third, and half of fourth fingers on the palmar side, and even some skin on back side of distal phalanx, first, second, third, and half of fourth fingers. Then nervus ulnaris, ulnar nerve, its palmar branch, supply like lesser half of your hand in the area of hypotenor, and supply all fifth finger, palmar side, and medial aspect of all fourth finger. It's palmar branch. Dorsal branch of nervus ulnaris go on the backside, and here we come to dorsal surface of hand. Dorsal branch of ulnaris go there and supply all fifth finger. It supply medial aspect of all phalanx of fourth finger, and lateral aspect of proximal phalanx of fourth finger, and even medial aspect of proximal phalanx of third finger. And we have one more nerve that supply hand. It's nervus radialis. Not all, it's exactly superficial branch. Ramus superficialis neuroradialis. It go here and divides on dorsal digital branches that supply like proximal phalanx of pollex, of dorsal surface of pollex. It supply proximal phalanx both sides of second finger, and it supply a lateral aspect of proximal phalanx of third finger, and half of dorsal surface of hand. Innervation of muscles are innervates by also this motor branches of these nerves, and on the level of brachium, anterior group of muscles of brachium is innervated by nervus musculocutaneus. Posterior group of muscles of brachium is innervated by nervus radialis. You remember triceps and conus. That's all. Forearm. Anterior group of forearm innervated by two nerves. Almost all of them innervates by medianus, and only flexor carpi ulnaris and ulnar head of flexor digitorum profundus innervates by ulnaris. And brachioradialis. Brachioradialis, it's related to anterior group, and it's innervated by radialis. Posterior group of muscles of forearm innervates only by radialis, by deep branch of radial nerve. And muscles of hand. Almost all muscles of tenor and first and second lubrical muscles innervated by medianus. All other muscles, hypotenor, middle group, and adductor pollicis and deep head of flexor pollicis brevis innervated by nervus ulnaris. That's all about your brachial plexus. I thank you for your attention. Ask me questions, subscribe to my channel, and see you later. Peace.